This is Dean from Top Performance Physio Chatswood, and I'm just going to be taking us through one of my favourite exercises to give people, which is a thoracic mobility exercise. So mobility of the rib cage and the middle back. This is super important because the middle back is considered a silent culprit. So what that means is not many people actually present into the clinic saying, I have back pain right here. People usually go back pain, neck pain, or shoulder pain. However, they tend to think that the middle back is involved behind the scenes in all cases of lower back, neck, and shoulder pain. And this is even more so important in our modern world, especially off the back of COVID, when everyone was working from home, sitting at desks and all the rest of it. A lot of us with our jobs become gummed up and tight through the middle back, and that can block our ability to go overhead, both in terms of range and power. It can also impact our neck range of motion and even our lower back. And in some cases, it can even limit hamstring mobility via the sciatic nerve. So how to do this exercise? The best way I prefer to do is to get a pillow. Otherwise, when you're going to be doing this and you don't have head support, you're going to be trying to lock your neck in place the whole time, and that can actually make things aggravating, and you're going to be too tense. You're not going to be relaxed and decompressed. That way, you're not going to be able to get the most out of the exercise. So, what you do, you get onto your side, like so, with the pillow as we discussed, and you bend up both knees, and you stack them so that way they're nice and aligned. And then what you want to do from here is you take your bottom hand, and your bottom hand goes on the top knee, and you lock it in. And then from here what you want to do is you turn from your spine. So think of your chest moving. You don't want to just be thinking of your arm. Turn from your spine, okay, as if you're going to hit the alarm on an alarm clock, if people still use that. And then from here what you want to do is turn again from your spine the other way, all the while locking in your knees. You go as far as you can without hurting yourself. You should be feeling a stretch through the middle back. You might even feel some stretch through the chest, and that's okay. And then from here you return, hit the alarm, open the book. Now, the thing you want to watch out for is as you're doing that open book position of the exercise, you want to make sure that your knees don't unlock. So I get a lot of patients that teach them the exercise and they go, well, that's easy, I've run out of room. But they've unlocked their knees. So they've actually mostly moved through the twisting of the pelvis and the lower back. So lock it in and then do the technique like so. Come back. You don't really want to stay there. You want to keep it moving, as if you're greasing a door hinge. Don't lock in the neck, so just let the neck naturally go with it. Another common error is people do this. The arm is just a marker to show how far you've turned. The drive should be coming from your middle back. Now, the important thing to remember is you want to do both sides when you're doing this exercise. You want to balance it out, otherwise you'll start to warp your posture. 15, 20 repetitions is good enough. If you are experiencing pain when you do this, it'll probably be best to check in with a physiotherapist just to make sure that A, your technique is okay, and B, whether it is the appropriate exercise for you, and C, whether there is something going on behind the scenes that needs extra assessment. Enjoy.